talking about organ transplants. The first one that we'll be talking about is the heart transplant. On the left is the picture of a healthy heart. On the right is a picture of a non-healthy heart. First, what is a heart transplant? So heart transplant is surgery to remove a diseased heart and to replace it with a healthy heart from a donor. The donor can be, the donor is usually dead. To help improve their quality of life. The surgery typically lasts around 4 hours, and the person is going to be placed on a heart-lung machine to help keep blood circulating throughout their body. And the average life expectancy for a person who has a heart transplant is 9 years after surgery. Different reasons to get a heart transplant. Most patients who get heart transplants have end-stage heart failure, or they have coronary heart disease. So this is the coronary artery normally, and this is what it will look like in a diseased heart. You can also need a heart transplant if you develop an infection which damages your heart, or if you have a hereditary condition passed down from through generations. After surgery, you are typically put into the ICU or the CCU, which is the cardiac care unit. You will mostly stay in the hospital for up to 3 weeks after surgery, and you will be placed into a cardiac rehabilitation program. Before leaving the hospital, you will have to learn how to keep track of your weight, blood pressure, and your pulse, and also learn what to do in the event of heart infection or heart rejection.
I did lung transplant. There were reported 3,700 lung transplants in 2012. Some reasons for having a lung transplant: they have lung disease is so severe they can no longer enjoy life. They are considered if they don't get it, they might not live. They are hesitant to perform their surgery with people over the age of 60 or 60. Names of some lung diseases treated by a lung transplant: chronic obstructive pulmonary disease, cystic fibrosis, life-threatening, and it's common in kids and young adults, and sarcoidosis, 5% death rate and the exact cause is not identified yet. And success rate of the transplant: 1 year is said to be somewhere near 80% of success rate. 5 years is said to be somewhere near 50% of success rate. Only 55% of patients survive 5 years after transplant, and only a third of patients last 10 years.
Okay, so this is, I did the eye transplant. Who did I go to for? How do you go back?
There's a back arrow. Use the computer. There you go. There you go.
You run manually or with.
Okay. So why is it done? The procedure takes place when an individual's optic nerves are damaged. The cornea can be unclear and damage, causing a person to become blind. Disease can cause a person's cornea to become scarred and swollen, leading to needing new corneas transplanted. So donors and how it's done. The donors could be of any age, and the surgery is performed by an I don't know that word.
I don't know if any of us do.
Ophthalmologist.
Ophthalmologist, yeah, there we go.
Donors are usually dead individuals, and the eye cannot be, the whole eye is not fully transplanted, it's just the cornea, so it's like the little layer of I don't know what it is, but it looks nasty. there not being any blood vessels in the cornea. So it usually comes from a donor when you can get an infection when the donor was sick prior to passing, such as having like cancer or something. And then the bacteria and the fungi can build up in the eye as well. Is that it?
That's it.
Is that it?
Are you done?